Welcome back to Biz TV Health Talk. In our last episode, we saw how inflammation set the heart on fire. Now, we enter a new battlefield, your brain. Protected by three delicate layers called meninges, your brain usually floats in peace. But when pathogens slip past the blood-brain barrier, inflammation doesn't just protect, it can kill. This is meningitis. Meningitis is a sudden, aggressive inflammation of the protective membranes, the meninges, surrounding the brain and spinal cord. These membranes act as the brain's armor, but when inflamed, they create dangerous pressure inside the skull. This pressure can quickly disrupt brain function, leading to symptoms like severe headache, confusion, seizures, and even death. The brain is protected by the blood-brain barrier, but bacteria or viruses can sometimes break through, triggering a powerful immune response. Swelling inside the rigid skull is especially dangerous because there's no room for expansion. Unlike a swollen ankle, the brain can't stretch, so pressure builds rapidly, threatening vital brain tissue. Meningitis is a true medical emergency. Every minute counts. Recognizing the signs and acting fast can mean the difference between recovery and catastrophe. Understanding how this inflammation starts and why it's so dangerous is the first step in fighting back. Meningitis isn't just an infection, it's a neurological crisis that demands immediate action. Not all meningitis is the same. Bacterial and viral forms differ greatly in severity and treatment. Viral meningitis is more common and usually less severe. Most people recover fully with rest and fluid. Bacterial meningitis, however, is a medical emergency that can cause death or permanent disability within hours. Bacteria like Streptococcus, pneumonia, and Neisseria meningitidis are especially aggressive, spreading quickly and triggering life-threatening inflammation. Bacterial meningitis can also lead to septicemia, where infection spreads throughout the body. Even with treatment, 1 in 10 may die, and survivors can face lasting disabilities. Bacterial meningitis often strikes healthy people in close quarters, like college dorms or military barracks, spreading through coughing, sneezing, or sharing drinks. Doctors always assume bacterial meningitis until proven otherwise, starting treatment immediately. The difference between viral and bacterial meningitis is the difference between a serious illness and a potential catastrophe. Rapid recognition and response are critical. Early symptoms of meningitis can look like the flu, but certain red flags demand immediate action. The BURNS rule helps you remember the key warning signs: blue or blotchy skin, unresponsive or hard to wake, rash that doesn't fade under pressure, neck stiffness and severe headache or sensitivity to light. The glass test can help identify a dangerous rash. If it doesn't fade when pressed, seek help immediately. In infants, symptoms can be subtle: irritability, high-pitched crying, refusal to feed, limpness, or a bulging soft spot on the head. Meningitis can progress from mild symptoms to critical illness in hours. Never wait to see if things improve. If you spot these signs, get emergency care right away. Trust your instincts, especially with children and young adults. Knowing the BURNS rule can save lives. Quick action is your best defense. Don't hesitate. When in doubt, seek help. When meningitis is suspected, doctors race against time to confirm the diagnosis and start treatment. A lumbar puncture or spinal tap is performed to analyze cerebrospinal fluid for infection. While waiting for results, doctors immediately start high-dose intravenous antibiotics if bacterial meningitis is possible. Early antibiotics are crucial. They can prevent irreversible damage. Corticosteroids may be given to reduce brain swelling and pressure. Patients are closely monitored in the hospital, often in intensive care. Rapid diagnosis, immediate antibiotics, and intensive support are the keys to survival. Acting fast saves lives. The best defense against meningitis is prevention. Vaccines have dramatically reduced cases and saved countless lives. Vaccines like Hib, pneumococcal, and meningococcal are part of routine immunizations for children and teens. Staying up to date on these shots protects you and those around you, especially the most vulnerable. Vaccines create herd immunity, shielding those who can't be vaccinated. Know the signs, trust your instincts, and seek help if you suspect meningitis. Prevention and awareness are your strongest shields. Always consult a doctor for concerns or symptoms. With vigilance and science, we can protect ourselves and our loved ones from this dangerous disease. This segment is for educational purposes only and is not intended to diagnose, treat, or replace the advice of a licensed medical professional. If you suspect meningitis, seek emergency medical care immediately. Biz TV Health Talk is proudly brought to you by XL Health TT and Times Square Media. This content is intended for educational use only. For medical advice, please consult your doctor.